So welcome to the Cypress Center. I just want to tell you a little bit about what we do here. We are a crisis intervention place, or a designated receiving facility is actually what we're called, but it's crisis intervention.
Okay.
People usually come here when they have increased symptoms of just almost anything, like they have maybe suicidality or just things that put them at risk in the community, and they need a little extra support to kind of learn how to reduce their symptoms so they can be safe back out in the community.
Okay.
We refer out to other therapists if somebody doesn't already have a therapist. We work with somebody's therapist if they already do have one, and we just come up with crisis intervention plans to help come up with a plan if your symptoms increase again. We have daily treatment team, which is where myself as your counselor comes in and talks to the med provider and the nurse on call, or not actually on call, but the charge nurse. Okay. And then we all come together and talk about what's going on to figure out if there's a medication that you need to be on, if a medication adjustment needs to be done, anything like that. So that's basically, we have groups, we have IMR, illness management and recovery. We have an exercise group. We have a discussion group where a lot of times we talk about like DBT skills, which is dialectical behavior therapy. I know it's a lot. I know it's a lot, but which is just basically some coping skills to help you cope with things. So we will throw a lot at you in about 3 to 5 days to try to help you come up with a plan to reduce your symptoms and to keep them manageable while getting some support from a long-term therapist.
Okay.
So that's kind of the plan in a nutshell. Now, I have paperwork here that tells me why you came to us, but I'd rather hear it from your own words.
Well, I wasn't feeling so good for a little while, I suppose, and sometimes I would cut myself on my arms or wherever, and it would just make me feel better. And then I suppose I started doing a little bit more and a little bit more, and then I feel like I was just doing it all the time, and I don't think it's good, and I really need to stop, but I can't do it. I don't know how. I don't know.
Okay. So, how often, you said all the time, how often would you say? Is that daily? Is it weekly? Is it monthly?
Well, right now I would say it's weekly for sure, a few times a week.
Okay. Mm-hmm. All right. Now, when did you start cutting? Like how long ago would you say that?
I would say probably at least like 6 months ago I started, and it was just like every now and then I would do it just like once or twice a month, and then it was started getting like 3 or 4 times, and now it's just a few times a week, and I'm running out of places.
Okay. Now, would you say that you're running out of places because you're running out of places to hide it?
Yes.
Oh, okay. All right.
Yes.
So it's not.
I don't want everybody to see it because that's embarrassing.
Okay. All right. So you don't really want anybody to know this is going on.
Right.
Okay. All right. So 6 months ago you started. What do you think? Well, what do you think you were feeling at that time? Like what? You say you're not feeling great. What does that mean?
Like bored, I guess. Like there just does not seem a lot going on in my life, and like not feeling good, I guess. And so when I would cut myself, then I would feel like alive, and I would feel pain, and I would feel like something's happening, and then I would feel motivated to do something else.
This is awesome. Okay, so you're saying there's not a lot going on. It sounds like you kind of feel like you're in a rut.
Yes.
Okay. Now, are you working?
I am.
Okay. And how about family? Like, who are you living with?
Myself and my son.
Okay. All right.
It's pretty quiet.
All right. But you do have your son.
Yeah.
Okay. And so would you say, it sounds to me like you almost feel like a little numb, like you said you cut to feel something.
Yeah, it is. It's just I feel like I lead a boring kind of life, and it's the same old every day. And so if I cut, the more I feel like I have feelings.
Okay. Now, you said 6 months ago. So was it that's when you started?
Yeah.
Was there anything new that happened, like any kind of stressors? Like, was there a loss of relationship? I don't even know, like a loss of job, any kind of stressors, or stressors can sometimes be a good thing. So a stressor can be like a new child, like I don't know how old your son is.
Yeah.
A new child, a new relationship, a new job, schooling. I don't know.
I got a new job in September. And also, I have to think about my son. He's going to be going to school the next fall. So I try to think a lot about what's going on with that and how I'm going to get him to school and how my work is going to go around that. And I have school going on, and it's
sounds like you actually have a lot going on.
Yeah.
But maybe not a lot of like recreational stuff.
Yes.
Okay.
Yes, that's probably what's going on. It's always just like work, 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 work and, it's all work, really, I feel like, trying to figure out where my son is going to go, that's work. School is work, and then work is work. So it's work, 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 and and that's it. And there's no fun.
Well, first, there's a couple of thoughts that come to mind. Number one, you started a new job. How did you feel about it when you started a new job?
It was fun and exciting, and I was excited to get back to work so I would have, something, to do all the time, and going to work is a good thing to have. So that was exciting.
Do you think you felt like you've been on a rut for a long time, or just like the last 6 months?
Probably the last 6 months. Like I felt like I was in a rut for a little while, and then I got out of that rut. Now I feel like I'm in a new rut.
All right. So yeah, and then unfortunately, I can definitely relate with that one. So, you thought the job was gonna be fun.
Yeah.
How did it turn out?
It's not quite as fun. I feel like I'm having a hard time fitting in, and like I'm going against the grain.
Okay.
So I just go in and get to work, and that's not much fun at all.
Not very fulfilling.
No.
Do you have anything in your life that's fulfilling?
My son. That's fun. I like spending time with him when we get to spend time together.
Okay. How much time do you think you get to spend with him?
Probably 2 hours, 2 to 3 hours a night, and then the weekends. On the weekends.
That's good. That's really good. So, yeah, it's really important to have fulfilling, activities in order to feel like you have a purpose and not so much in a rut. I mean, it's going to happen. We're going to feel like we're in a rut sometimes, but I can see how feeling that every single day and getting to the point where you're feeling numb would be super, super, super difficult.
Yeah.
So do you have any like supports or friends or anybody besides your son?
Well, I have some friends in the neighborhood that I can call. My family is around, but they're not very supportive, I don't think.
Okay.
I have some family that's far away, and they're supportive, so I can call them, I guess, and talk to them on the phone.
Okay. You don't have anybody you can just like kind of go hang out with and have a little fun for yourself?
Sometimes, but not
that
really.
Does not seem like it. That was very delayed. I'm sensing not so much.
No.
So, supports are really important in having that time to yourself. So it really sounds like you don't have much to yourself, and the cutting is just a quick way to feel something and to get some relief and to increase your mood.
Yes.
It sounds like your life is very like you got to go, 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 go. So it's not like you have a ton of time to go do something else.
Right.
So we might talk about how you can prioritize and work some of that in order to help you feel a little bit better.
Okay.
So now we are kind of like a faith-based facility. So how are you with your faith? Do you have any faith? Do you not have a faith?
Well, I believe in God.
Okay.
And I just started going to church not too long ago, but I don't really know a whole lot about it. So.
Okay. Well, we can help you out a little bit there.
Okay.
And I mean, I immediately come to for you with the cutting and the feeling like you're in a rut and just feeling that numbness. Like I come to what we call the DBT. I had mentioned the DBT skills. Have you ever heard of DBT before?
I heard of it, but I don't really know what it means.
Okay, it's dialectical behavior therapy. It's very similar to cognitive behavior therapy. Have you ever heard of that? That's like your thoughts.
Mm-hmm.
Often, like what you're thinking about a lot can lead to you feeling certain things. And then our thoughts and our feelings lead to us actions a lot of times. So, which we want to kind of help you learn to kind of channel your thoughts and think a little differently. We have like cognitive distortions, which are, I love cognitive distortions. I think they're great because I use them a lot. Like personally, I have a hard time. Like black and white thinking would be one. Something's either all good or all bad.
Okay.
So it's like my job, I'm super excited about my job and it's going to be great and it's going to be wonderful. And then it happens and I'm like, this sucks.
Yes.
And it's just this huge letdown and everything sucks about it.
Yeah.
Like now I have to figure out how I'm going to get my kid to school and I'm not making much money and I don't like the people I'm working with, and which could all be true.
Yeah.
Right.
Yes.
But at the same time, I'm making some money and I'm paying my bills. I'm able to have a quiet ride to myself on the way to work because my son's at daycare.
Yeah.
And looking for the positive in those things and just being able to kind of create an attitude of gratitude.
Mm-hmm.
And seeing dialectical, for the dialectical behavior therapy, the good and the bad, like the yin and the yang.
Okay.
Does that make sense?
Yes, that sounds good.
And so we talk about those skills here, and we talk about a lot about mindfulness skills, which is kind of being in the moment and enjoying the moment, like those moments you have with your son.
Yeah.
Do you ever find that when you're with your son, you're not actually with your son? Like your head is somewhere else.
Yes, that happens frequently. We're in the same room, we're in the same space, but he's doing his thing where he's watching TV and I'm over here doing probably my schoolwork, and he's doing who knows what over there, but he's over there and I'm over here, and that's it.
Yeah.
So it's not really a 2 hours after work and after school. It's probably less.
Yeah. So you're doing school too.
Yes.
Yes. So yeah, you've got a lot going on. So yeah, for me, I can honestly tell you that sometimes I can be maybe with my family or something, and they might even be talking to me, but in the back of my head, I'm thinking about the million other things that I need to get done.
Right.
And I'm kind of hearing them, but I'm not like fully in the moment with them.
Yeah.
And enjoying that moment. So like our kids are great, when you said he's about to go into kindergarten.
Yeah.
So he must be around, 4 or 5 years old?
5, yeah, just turned 5.
That's such a fun age, and they like to laugh a lot and goof around. Yeah. And so maybe being in the moment, learning how to do that, because it's not an easy thing in our culture, right? You're a single mom, so you're responsible for a million different things. Like, let's talk about how to, get back into that moment and really enjoy his giggles.
Mm-hmm.
And let that fill you, and just learning how to do that. So it's kind of learning how to focus, right?
Right.
So, and with all of these, like we talk about the mindfulness skills, I actually have different verses because it's all these skills, you can find them in the Bible. It's not originated from like a Christian perspective per se. It was actually originated from like Buddhism and all of that different stuff. But these skills can be found in the Bible as well. Okay. So it's not like it's anti-biblical or anything like that. So it's just really learning what God has to say about how we're supposed to live and how we can find enjoyment in life.
Okay.
So that purpose that you're looking for, hopefully we can find some of that. And in finding some of that, maybe we can learn to reduce some of the cutting.
Mm-hmm.
And also, we can also talk about there's some crisis skills that you can do.
Okay.
Some of the things that help somebody who likes to cut, some of the physiological, like physical responses that we get. Our body literally responds from cutting and pain.
Yeah.
That's why you feel relieved.
Okay.
Okay. So another thing that does that is ice.
Oh.
Holding ice or putting ice on the back of your neck or jumping in an ice cold shower.
Okay.
Your body will respond in the same manner to that as it does to the cutting.
Oh.
And you won't have all of the after effects of the cuts on your arms, like being worried that somebody's going to see it, the embarrassment, and also the real risk with cutting is infection.
Oh.
So those cuts can get infected.
Yeah.
And then and it sounds like you're already embarrassed about it, right?
Yeah.
So if it gets infected, you're going to want to go to your doctor and be like, hey, look, I cut myself.
Right.
And now it's infected, so I don't want you to end up cutting yourself, getting infected, and then now wanting to go to talk to somebody about it.
Yeah. And then it might get even worse.
Yeah. And also, just real quickly, I want to ask you, when you're cutting, like, what are your thoughts on that? Like, what is your intent when you're doing that?
My intent is to feel happy.
Okay.
Really, I feel like it creates a euphoria for me. Like when I cut, I'm gonna do that and
Feel better.
feel better. Yeah.
So if you had another option that helped you feel that way, you would do that.
Yeah.
Okay.
Yes, for sure.
All right. Do you ever feel like you don't want to live anymore?
Sometimes, I suppose. I feel like I'm not really getting anywhere, so.
Okay. Is it like I don't want to live and think of a way to.
Are you